Dyspnea, high BP, blood sugar, low HDL, central obesity. I need to find out if that's from his meds.
And it didn't occur to you to maybe just call in psych for a little consult? I've been here all day.
He's not your patient.
You're looking an awful lot like a psych patient to me.
Not today. Today he's an ED patient with metabolic syndrome.
He just flipped out because you took him off his meds.
To keep him from having a coronary or stroking out, he is over-medicated.
You can't know that.
Quetiapine, lithium, lamotrigine, all neurotransmitter modulators. They overlap. They're redundant.
They are not redundant. The two mood stabilizers are actually complementary. Okay? And quetiapine...
Yeah, you guys love to medicate.
You can't just stop it. I mean, honestly, Dr. Ripley, I think what you did today was... I thought it was reckless.
Reckless?
Reckless.
Well, come on, Dr. Charles, why don't you just say it? Impulse control disorder. Isn't that what you called it back then?
Oh, so you took him off his meds because of me?
I took Mr. Shore off one drug, the one most likely to be causing his metabolic symptoms, and I did so in a controlled clinical setting. Now, I'm an attending physician at this hospital. Do not treat me like the boy you knew 20 years ago.
Dissecting soft tissue to prepare the anterior C1 ring for the AO transarticular screws.
2.0, what is the ideal screw entry point?
Ideal entry point is lower 1/3 of midline of C1 lateral mass, just above C1-2 joint capsule.
Yeah, that's what cadaver studies in our simulation suggested.
Drill. Okay, starting with the left side, drilling laterally, posteriorly, and upwardly.
The kid's end-tidal CO2 just dipped. 2.0, it says?
Based on baseline and trending vitals, there is high likelihood of venous air embolism.
Is that really the case? Slight dip could be bronchospasm, poor tissue perfusion, or nothing at all?
Yeah, 2.0, verified venous air embolism, please.
Verified. There is a greater than 75% chance of mortality or catastrophic outcome. Address immediately.
I don't know, maybe the damn thing's hallucinating again.
Yeah. BP's just a tad low, 85 over 49.
Hey, we need to finish the surgery, get this kid off the table.
Oh, hold on. Lower his head, place a precordial Doppler, and set up for a transesophageal echo. Crockett, an air embolism could kill him. We have to know what we're dealing with. That sound from the Doppler? It's air bubbles. Yeah, I think when we drilled it to the bone, it got sucked into the vascular system. Not directly to the heart. BP's dropping more now, 65 over 33, and heart rate too at 36. There it is. Significant air bubbles.
Yeah, they're embolizing into the pulmonary artery, causing right heart strain.
Yeah, 2.0 is correct. Marty, give the kid 100% O2 and bag him up. Coming. But I'm having trouble ventilating and oxygenating. 80% static.
Confirmed. Critically significant hypoxia and poor systemic perfusion.
I have to suction the air out of the kid's heart, give the Swan Gates catheter. Seeing ST segment changes on EKG.
Got about a minute before complete cardiac collapse.
We're going to flood the existing course right into the pulmonary artery. Vitals are tanking. Systolics in the 40s.
Get a crash cart.
The right ventricle balloon up. Balloon's up. Go ahead. Okay, advancing.
Any day now, Crockett.
Almost. Okay, I'm in the pulmonary artery. Syringe? On it. No air. Barely seeing an arterial trace. He's bradying down.
Cardiac arrest is imminent.
Push a milligram of atropine now.
Advancing further. Balloon down.
Come on.
Got air. BP, heart rate.
Pulmonary air embolism successfully addressed.
Audrey? Thank you. You're welcome. Poor Harris. He works so hard to stay well. It's a rough illness. I wish more people saw it that way and not as some kind of failing. Your husband's one of the rare ones who understands. He was always so good to our son. There was a time that Harris had to be hospitalized. Michael was so scared and upset, and Mr. Ben really helped him through it. Made him see that people can get sick in different ways. and that his daddy was gonna be okay.
It will be, Audrey. It will be.
That was nice. What you said about Ben.
Yeah, to tell you the truth, Doris, I really don't want to hear about Ben.
Okay.
Hey Doris, what's happening with the hamster?
No one wants it. I called animal control.
Dean, I saw tomorrow's surgical schedule. Looks like you're getting that transplant.
Yeah.
Dr. Charles, Judith's CT showed an acute subdural hematoma. Her doctor has her own blood thinner, so it could get worse.
So she needs surgery.
Yeah. Thing is, she's refusing treatment. Says she wants to die. She's suicidal. We could hold her.
We could, but let me have a chat first.
Yeah.
Judith, I'm Dr. Charles. We met earlier today. I don't know if you remember that. I am being told that you don't want us to treat your hematoma. It's just important for me that I know that you understand that if left untreated, that it could kill you.
I don't deserve to live.
Okay. Can I ask you a question? If somebody that you knew and that you cared about were in exactly the same situation, is that what you'd say to them? Would you say that they didn't deserve to live? I mean, I don't think so. You wouldn't, would you? What you'd say to them probably is, wasn't your fault.
But this was my fault. I hit the brakes and the car just started spinning and I crashed first and then all of the other cars started to crash behind me. If it hadn't been for me, none of this would have happened.
You had some black ice. It was an accident. You didn't hurt all those people on purpose. One of the hardest moments in life is when we figure out how little control we actually have over the things that happen to us, right? But what we can control is how we respond to them. And I just know that with a little time, clarity will come, you know, and maybe, just maybe, you might even get around to doing one of the hardest things that a human being can learn how to do, which is to forgive yourself. But if you don't let us help you, there's just no chance that that's gonna happen. So, would you let us help you? Okay. Okay, Bryce, squeeze my hands for me.
Good, good. Can you wiggle your feet back and forth? Okay, now, stick your tongue straight out. Even the hypoglossals working well. I think your son's gonna be fine.
Thank you.
You got it.
Thank you.
We'll give you some time with your boy.
Did you hear? Ivy was an organ donor.
Oh?
Yeah, Dr. Archer had her typed. Turns out she's matched for a little girl here who needs a kidney.
Archer. No, I hadn't heard.
Just thought it might make you feel a little better.
Max, grab your coat and I will walk you to your car.
No. Janine's running a couple hours late, and I said that I'd cover for her until she gets here.
No, you've been working nonstop all day. Have somebody else cover.
That's okay, I don't mind.
We need to go home to Ben. He's probably wondering where his wife is.
Ben's just fine.
Bad guy like Ben waiting for
Just
me.
stop. Stop. I keep still talk about my wonderful Ben. All my wonderful husband wants a divorce.
Yeah.
Mitch.
This is about Mr. Shore. He is rational again, back on his full panoply of meds. We still need to address his metabolic issues, and soon.
Oh, can you pause real quick?
But you know what I really came up here to tell you is how impressed I am with how you turn your.
Are we watching Chicago Fire too, right?
Yep. Then
Okay.
you guys can watch Joel when I go work on some dishes.
Okay. After this,
Uh-huh.
I'd like to get some strawberry pie if you have some.
Yeah. We don't have any clean plates.
You kidding me, Mom?
We got really firm paper plates.
What about your styrofoam plates?
Yeah, I was just thinking that. I would just have to wash a fork.
Mommy, do you ever do?
Yes, I will catch up on dishes.
Okay. And
Well,
takes-
yeah. You mean
takes-
after this one before fire?
Yeah.
Okay.
And maybe some grass and milk or something.
All right. I'll go buy a cow.
Mommy, you're a cow.
Hi, Fuji. Hi, honey.
Hi, Mom.
Jesus, I would drink milk if you had a cow.
Hi, Mama. Just a few last weekend here.
No.
Boy, this is gonna feel strange. Okay.
Your life around. You know, truly, I mean, you've done so well.
Better than you expected.
Well, I mean, you had a lot to overcome.
Yeah. Top of the list, maybe county juvenile. My psych care, remember? Aldol's, Iprexa, the whole candy store.
I do remember. Remember that you were violent and you were aggressive. It was a big place, a lot of kids. You know, we had to protect them.
Chemical restraints. It worked. I couldn't move, couldn't sleep, couldn't pee either. It was fun times.
Look, we know a whole lot more about those meds now than we did then. You know, we've gotten much better at dosing them. I mean, frankly, you probably were over-medicated. You were.
And then you booked.
I booked.
You took off, you left.
Well, I mean, I imagine that's because I had my rotation was probably.
Okay.
Okay, so William, you want some pie?
Yep. How about you, Nana?
No, I had some before and I liked it, but I think I'm not going to have a second piece.
Cool Whip, William?
Yeah.